Good morning, everyone. Thank you for the opportunity to talk about crisis services. I am Stephanie Lewis, the Division Director of Crisis Services at Alameda County Behavioral Health Care. And feel free to put questions in the chat. Someone will be monitoring the chat, and we will answer questions throughout this presentation. I hope everyone's doing well today. I'm a little under the weather and a little nasally. I'm having some kind of reaction to all of the ash that's in the air. So apologize in advance if I have to, drink water and take some breaks. All righty. So I've been with Alameda County Behavioral Health Care for nearly 13 years this month. And prior to coming on board, I worked at Berkeley Mental Health on their crisis services and their mobile crisis team. Worked there for 7 years, and then I transferred to the county, worked as a frontline clinician on mobile crisis, and then promoted, and here I am. So this is crisis work is what I was put here to do. All righty. Okay, I'm trying to, oh, there we go. Sorry, it may jump. I think there's a little delay. This happens. So I'm just going to start with our mobile crisis teams, and I'm going to talk about outreach and engagement teams and other numbers you can provide to those that you're working with when they need mental health services or have an urgent crisis situation. And so our mobile crisis teams are staffed by licensed clinicians, and they provide crisis mental health intervention to children and adults throughout Alameda County. There's always been a myth in terms of our mobile crisis teams that we did not provide services to children, and we do. So children, youth, transitional age youth, adults, older adults. And we currently have 3 types of mobile crisis teams. So the first one is staffed by clinicians. So it's the mobile crisis team. This program has been around since 1988. We provide crisis intervention, 5150 and 5585 assessment. 5585 is the Welfare and Institution Code for involuntary hospitalization of minors. And so a lot of people are familiar with 5150, but 5585 is, like I said, for youth. We provide diversion, referral to a wide range of services, including mental health and SUD services, substance use disorder services. Our current hours are listed there, and that particular mobile crisis team is dispatched via 911 or by calling our headquarters directly, and that number is listed. Currently, we're Monday through Friday with a planned expansion to 7 days a week as soon as we fully staff up. So I don't know, I know you all work in a variety of locations, but with COVID and just living in the Bay Area, we have had some difficulty in recruitment. So our efforts continue in terms of that. So our second model we have is the mobile evaluation team. And this particular team is just in Oakland, and it is staffed by a clinician and an OPD officer, so Oakland Police Department officer, and we provide the same services. We started this program in 2014 as a pilot, as an expansion of our mobile crisis teams with a focus on East Oakland, because we really weren't getting to that part of the county. Most of our calls were in downtown Oakland, West Oakland area. And so we got some Mental Health Service Act money in 2014 to try a new model, and we tried the mobile evaluation team and found that it was a pretty efficient model in getting to calls very quickly. And currently we have one team that responds in Oakland, also dispatched through the 911 system or by calling our headquarters directly. We are working with OPD to expand those services to weekends. And this is a little bit more complicated because we have to also staff a clinician, but also an officer who's interested in this work. Currently, we have an officer who is a former nurse. So it's a great collaboration, and we're able to get to calls. The third model is a new pilot that we started July 2020. So right in the middle of the shelter in place and COVID-19 is our community assessment and transport team, which is a collaboration between Alameda County Behavioral Health, Bonita House, and Emergency Medical Services and SALC. And we started developing this program through Whole Person Care. And I think it's 3 years after all the work we've done, we were able to roll out those teams. What's unique about this particular team is that it pairs a clinician, a licensed clinician, with an EMT. And we use a modified vehicle, so not an ambulance. And this team can transport a wide variety of dispositions in an effort to really divert from John Doerr psych emergency if the person doesn't need to be hospitalized, and emergency departments. A lot of the folks that we have contact with spend a lot of time going in and out of emergency departments or showing up at psych emergency when they may need a refill or they're experiencing a mental health crisis, but it doesn't reach the level of involuntary hospitalization. So through the collaboration, the use of technology to figure out where beds are available in our subacutes, which I will get into later, we are transporting people to more appropriate services. And so CAT is supposed to expand to weekends probably later this month. Currently, we are running Monday through Friday, 8 hours a day from 8 to 8. So right now, if you needed assistance or a person you're working with needs assistance in terms of a mental health crisis, we are available in a variety of formats from 8 a.m. to 8 p.m. Monday to Friday. And so when we expand to weekends, we will send out that information to all of our community partners because we know that weekend support is important. Any questions about our mobile crisis teams?
So when we call 911, do we have to request a mobile crisis team?
So I have a slide that speaks to that. Yes, you would describe to dispatch what's going on and ask for a mental health unit. I would also ask for a CIT trained officer, and CIT stands for Crisis Intervention Training. So you're looking for officers who are trained in dealing with individuals who have mental health needs and substance abuse needs.
Stephanie, we have another question. Are crisis teams going out in person or just over the phone during the pandemic?
We go out in person. So we had initially, some of our outreach and engagement teams were working remotely, but our mobile crisis teams have never stopped working. So we've always had PPE to use. Oftentimes we're going into homeless encampments or into people's homes where there's hoarded situations. Sometimes there are infestations of scabies and lice and things like that. So although COVID added another level of complexity, didn't really change our work that much. So we are responding in person. Thank you for that question.
What's the ETA after dispatch?
So it depends on the nature of the call. It also depends on what part of the county, and also where our teams, if we're on a call or we're just in the office waiting to get a call. Our goal is to respond within 20 minutes to an hour, but if we're really, really busy, which often is the case in Oakland, it may be an hour or so. Later in this presentation, I have the direct number to our headquarters. When you call our headquarters, you would be speaking to an on-duty clinician, and that person would give you an estimated ETA. That clinician would also encourage you to either call 911 if it's something urgent. Say, for example, you have a consumer or a client who's reporting that they just took an overdose of pills. That would be a 911 response. And so that clinician, on-duty clinician, would instruct you to call 911 and request a mobile unit. So that would be a quicker response than a person who may have more of a chronic issue. You may have a client who's a hoarder who has been losing weight lately, and you talk to that person and they didn't sound like they're, at baseline, how they normally sound, and you have concerns and you're requesting a welfare check. So in our system, we would enter that information into a database, and we would be instructing our mobile crisis teams to respond within, an hour or so. So you would get that information when you call us directly, our estimated time of arrival.
Stephanie, we have another question.
Yes.
If it's if there's an issue outside of these hours and it's not an imminent issue, like what you just talked about with the overdose example, would you recommend calling police, non-emergency, or 911?
If it's not an emergency and it can actually wait to the next morning, I would suggest you call and leave us a message so that we can follow up the next day. But if that doesn't sit right with you and you are calling police, you can call the non-emergency number, but depending on what city you're in, you may be waiting for a while. My experience in calling the Oakland non-emergency number, you go through a phone tree, you're put on hold. And so if you have time to wait, you can do that. In other cities, like for example, Union City, Fremont, Newark, that wait time is less. So it really is for you to decide, is this a 911 emergency where I need someone to respond immediately in the middle of the night or after hours, or is this something that the mobile crisis team can follow up the next day? For example, the example I gave of the person who is living in a hoarded house, and you talk to them and they didn't sound like they normally sound, it wouldn't make sense to me to send the police out in the middle of the night to disturb that person. Doesn't seem like there's anything going on that's going to change between 8 a.m. and the next day when we come on at 8. And so you could leave us a message saying, I want to refer this person. I just talked to them. It's after hours. Here's the information. Please call me when you get in the morning, and a on-duty clinician would follow up with you. So you have options. You don't always have to use 911. Part of our crisis services is also trying to educate the community and providers and divert from the 911 system if you can. If you don't need to call 911, you shouldn't.
Thanks for that. Do other folks have any questions? Feel free to unmute yourselves as well.
Yes, you can definitely ask questions. It's nice to hear voices, even though I'm not seeing faces right now. I see David. All right, I'll move on to our outreach and engagement teams. And if another question comes up, even if it's from a different slide, we can always go back. And so we have 3 new outreach and engagement teams that we just started last year. And they're staffed primarily by peers and others with lived experience. We have some clinicians on the team, but we are trying some new concepts and staffing models to really outreach to individuals who are not securely engaged in voluntary services, or kind of falling through the cracks, or haven't really been able to connect to a service that is meeting their needs. And so our first program is Community Connections. They provide field outreach specialty for homeless individuals. Sorry, got tongue-tied. And the person doesn't have to necessarily just be living on the street. It can be a person who is couch surfing, or they're at risk of homelessness and they have some mental health issues that are impacting their ability to remain housed or be housed in appropriate settings. And so the goal of that team is to connect individuals to mental health services, primary care, substance use treatment, and other social services. And they provide care coordination. So say, for instance, if a person is already connected to services, but they aren't utilizing those services, and we at Crisis Services are getting phone calls from the general community, from law enforcement, referrals from businesses, we will do our research on our end. We have a database and a electronic health record that we would look into. And we would say, oh, this person is connected to the Trust Clinic, or this person is connected to Oakland Community Support. So Community Connections will really try to engage that person and help them securely connect to available services. Our second team is Familiar Faces. So this is phone and field outreach for individuals with frequent contact with crisis services. Many have low participation in voluntary services. And so also with this group, it's about engagement, care coordination, and information referral. Familiar Faces usually have at least 3 to 4 mobile team contacts within a 6-month period, and or 4, I can be getting those numbers mixed up. It's either 3 or 4, because we've changed it, with psych emergency services in the previous 6 months. So we're really trying to divert these folks from showing up in PES and having a lot of mobile team contacts to do. We provide an assessment and try and connect them to care. Our third team is post-crisis follow-up, Crisis Connect, post-crisis follow-up, and this is telephonic outreach 24 to 48 hours after a crisis event. And so we get a list from PES, and also we can refer through our mobile crisis teams in an effort to prevent a subsequent crisis, encourage them to follow up on the referrals that were provided, either at discharge from PES or from our mobile crisis teams, or from our providers who are trying to make contact with them. And we provide linkage, crisis assessments, and care coordination. And so we have primarily field team, we have a field and phone team, and primarily phone team. So the latter two, Familiar Faces and Post-Crisis Follow-Up, Crisis Connect, is they're pilots. And so we're just trying to see if we, through a unique staffing and also, you know, trying to engage individuals by showing up or providing a number for them to call us or for us to call them, if we can divert them and get them connected to appropriate services. Any questions about those outreach and engagement teams? And so, you know, the goal is to just provide this information. I'm not expecting you guys to know ahead of time when you call crisis services what team, what you need. You're going to call, you're going to speak to an on-duty clinician. That on-duty clinician will triage that call and determine who's the appropriate team to show up, either in person or make a phone call, and how soon that contact can happen. So you're just calling saying, this is what I have, I need some assistance. How to contact us. And so our number is there, 510-891-5600. You're gonna ask for an on-duty clinician. And like I said, they'll determine the appropriate team to respond to, oh, I put loved one. I did this presentation for families, and I haven't changed the slide. Yeah, well, it's kind of sweet. We do love our clients. And after hours, you would be calling the access number, which is the main referral line for all mental health and SUD services. And after hours, that number is answered by the 24-hour crisis line. So you can't go wrong by either calling us directly or calling access. Any questions about that? And these numbers can be given to individuals as well, to the general community. So here's a slide on response times. So post-crisis follow-up will make an effort to reach out within 24 to 48 hours. We'll make at least 3 attempts, and they can also refer to our other teams that show up in person if needed. So say, for instance, a person went to PES yesterday, and we're trying to make a phone call today. We will continue to try and reach out to them at least 3 times. We still have concerns that the person isn't answering or may be in crisis. So say, for instance, we call and, you know, we can't really share information because of HIPAA with, you know, a family member, but a lot of times when we call, it's a family member and they say, you know, if you're calling from any kind of services, this person is still in crisis. And so then we can dispatch one of our mobile crisis teams as needed. Our familiar faces and community connections will usually within the same day or within that week, depending on what's going on with that person. Sometimes we, especially with populations who are transient, people that are homeless, are moving in and out of hotels or changing their location, so it sometimes can take us a while to find those folks. But our mobile crisis teams, we will respond same day, for sure. I put this slide in here because we have always gotten questions from the general community, consumers, families, providers. Why do we involve law enforcement? And so there are many calls that we respond to where law enforcement is essential for safety of the individual and also for the providers going out. The other thing is, if we are evaluating for a psychiatric hold, 5150 or 5585, although our staff are authorized to evaluate and write a 5150, we are not authorized to detain someone. And so, you know, there are many times where individuals are experiencing symptoms that are causing them to feel very paranoid and not safe, and they want to flee. And so, you know, I always describe it as I can only be a good witness and describe the person as they run away. I cannot detain them, and it creates a huge amount of liability and safety for that person. So we really weigh out the need for law enforcement and how provocative that can be for communities, especially vulnerable communities, communities of color, individuals who are refugees or come from countries where a uniform meant a very different thing. And in light of, you know, all of the recent media coverage, you know, George Floyd, Breonna Taylor, and the host of names. So our clinicians are really, you know, hearing from the community about the concerns about reaching out to law enforcement when we say you need to call 911, especially when someone is actively doing something to hurt themselves or someone else. Also, if it's a medical emergency, calling 911 and requesting an ambulance, sometimes the ambulance is requesting law enforcement to make sure the scene is safe. And so if you are working with a consumer or a family and having the police show up at their home or to them is going to be provocative, we need to know that so we can provide some education and update law enforcement before they arrive. Like, this person, you know, is feeling very paranoid, you know, has experienced a lot of trauma, is terrified of uniforms, so that we meet the needs of that individual while also keeping everyone safe. We don't always control whether law enforcement are involved or not. Once we get on scene and we're doing the assessment and we have a code, a radio code, which is code 4, meaning that everything's fine, our clinicians can let that officer know, like, we're fine, we don't need you guys to be here, go back and do what you're doing. We will, you know, provide this intervention and we don't need law enforcement. But most of the time, law enforcement is involved at the beginning. So are there any questions about that?
Actually, we had a previous question, Stephanie. Oh, go ahead. Someone's on the phone right now. Please feel free to ask your question.
Okay. Caller, are you there?
We do have a clarifying question in terms of after hours. Should someone leave a message on the crisis line or should they call access?
You can do either.
Okay.
So you can leave it on the crisis line or access. If you call access after hours, you will get a live person at Crisis Support Services. So you can't go wrong by doing either.
Okay. And then for other folks, Stephanie, what's the difference between the two then?
What's the difference between the two?
Yeah.
So Access is the main referral line for all services. So sometimes providers are calling Access because they're trying to just connect the person to care to find out if the person's eligible for specialty mental health services. But when you're doing the assessment over the phone, Access may say, that sounds pretty urgent. Let me do a referral to a mobile team. And so you may start out just wanting to connect that person to care and you haven't even thought like maybe this is a more urgent situation. Crisis support services is just a 24-hour crisis line. So staff can call for themselves. You can also refer individuals from the community to call to get support. Those clinicians, some are paid, some are volunteers, they're going to be assessing also whether this is a call for a mobile crisis or 911. And so if you connect all of our services, there's a pretty much a web of coverage 24/7. And that's how you should view it. So during business hours, you can call us and ask for an on-duty clinician. After hours, if you call Access, it's going to be 24-hour crisis that's going to answer anyway. During the day, if you call the Access number, you can get information on a host of services available throughout the county. Does that answer the question?
I think so.
Okay.
Do other folks have any questions?
Okay. Also, if you have to call 911 and for a person who is experiencing a mental health crisis, like I said earlier, you want to request a CIT trained officer. So that's an officer who's trained in crisis intervention. And so that is a training that is a collaborative effort also through behavioral health care and the Oakland Police Department. That training is open to law enforcement throughout the county. Actually, we've had officers from other counties also participate. That training covers everything from, mental health 101, medications, substance use, individuals with intellectual disabilities, APS issues, so individuals who have Alzheimer's and dementia, and many other trainings like officer self-care, information on cultural competency, suicide interventions around suicide assessment, working with children, TAY. So it is a week-long training beyond what the officers how the officers normally get trained. And then if you're calling 911 and you're talking to dispatch, you want to just describe what's happening now. If you know this person, any history with law enforcement, like I said, it's triggering for them. They've had traumatic experiences. They have criminal justice history, meaning that, their reaction to law enforcement may be a little different. We want to get that information out so that the officers can, use a technique called time and distance. So they give a person a little bit more time and a little bit more distance so that we can really assess what's going on. You want to also ask for a mental health unit to respond if one is available. And if you know, any history of hospitalizations or if the person is experiencing any symptoms like paranoia, hallucinations, depression, if they're suicidal. There's also an AB 1424 form that I recommend that not only providers but also caretakers, loved ones, family members have. And it is a way to keep a record of the history of the person's mental health issues, and it's something that can accompany the 5150 form or 5585 form. I can make sure I share this so that you guys can have a copy of this. But if you just Google AB 1424, the form comes up. It's a useful form to have, and it's a way to provide historical information in an organized way that's quick, summaries, concise, all of that. Any questions about involving law enforcement? So once again, this is the Access program. We also have a separate number for substance use services, and that number is listed. And Access works very closely with Crisis Services. So if you call, like I said, Access, and you're trying to refer someone for services, or you're trying to look for the mobile crisis team, they send to our, we receive our referrals electronically through email. And so they could be talking to you, and then they're typing and sending us information. And so both can happen at the same time. You can refer someone for ongoing services, and if something is going on in that moment with that person, mobile team can also be dispatched. Any questions about that? And the substance use access referral helpline can refer individuals for both residential and outpatient services. And I think there, I just learned there's a new youth substance use disorder program. I think it's an outpatient program that just opened up recently as well. This slide just describes more about Access. Some of the questions I already answered. Crisis support services answers those calls after hours. And then both Access and Crisis support services can refer directly to us. In the last year, we also started through the adult and older adult system of care, same-day urgent medication clinics. And so we have 3 sites that are up and running. The first one is at Oakland Community Support, the third Tri-City Community Support Center, which is in Fremont, and then Valley, which is in Pleasanton. These are urgent medication clinics. What we found is that many individuals, whether connected to our care or not, are showing up in emergency departments and psych emergency because they need an assessment and may need medications. And so we started these urgent medication clinics in an effort to divert those people and provide services in a least restrictive environment. So these are voluntary, people can walk in. The suggestion is that you call first. There is a mental health specialist who is getting an initial assessment, and then we use telemedicine. So there's a psychiatrist on the screen that gets the information from the mental health specialist, and then there's a full assessment that happens, and that psychiatrist can prescribe. So this is for individuals who can actually get to the location, are voluntary, who can actually sit through the assessment, which can take an hour or more, depending on the complexities and if they have to wait, if someone's already being seen, and actually can go pick up those medications at a pharmacy. And so there also needs to be some connection to care. So sometimes people are walking in wanting the service, and there's a referral that Access receives for them so that they can connect them to ongoing care. So this isn't an ongoing service. This is an urgent medication clinic. A person can utilize it twice in a calendar year. And the goal is, like I said, to divert away from emergency departments and get this person connected to care. Any questions about those urgent med clinics? And they're for adults. We don't have any urgent med clinics for children at this time. Okay. Also within the crisis continuum of care, we have residential treatment. So these are residential programs where individuals can stay up to 2 weeks. It is respite, pretty much, and crisis stabilization. So these are voluntary services for people who are experiencing, a mental health challenge, are in need of urgent care, but don't fit the criteria for 5150. And so we have J. Mahler, which is in San Leandro on the John George campus. There's Woodrow, which is in Hayward. Excuse me, I'm gonna take some water. And then we have Amber House. Amber House opened, last year or the year before. I can't remember now. What's great about Amber House is that it is a crisis residential treatment program where people can stay for up to 14 days. But it's also a crisis stabilization unit in the same way that John George Psych Emergency, PES, is a crisis stabilization unit where people can stay for up to 23 hours, 59 minutes. And so a person can walk in from the community to Amber House and be in the CSU for 23 hours. And if they fit the criteria and want to stay for the crisis residential program, it is upstairs. And so this is a great diversion opportunity. Mobile crisis drops off at Amber House, law enforcement does, and people walk in from the general community. A lot of our case management programs transfer folks there. So these are great resources to have in the county in an effort to really meet people where they are and divert them from more costly or restrictive environments. Any questions about crisis residential treatment?
Yes, definitely. There's one. Can people walk into all three of them or only Amber House?
So for the CSU, it's Amber House. Woodrow and Jay Mahler do take referrals from the general community, but you should start with calling first. Okay. Anything else? Any other questions? Okay. More crisis resources. So 24-hour crisis line, I mentioned that earlier. There's also a text line. What we found is that, you know, we're now in the time of young folks and texting. I actually do a lot of texting too. I don't consider myself that young anymore. But so it's a 24-hour number to call. And then the text line is from 4 p.m. to 11 p.m. I'm assuming they started as a pilot and found that most young people text later in the day, but it's 7 days a week. These are services that are available to the general community. They've also staffed up during this COVID-19 time. Their calls have gone up, I think, 20 to 25%. And this is a number that anyone can call. Providers, consumers, family members can also text, of course. And then there's a nationwide hotline number. And then for those of you who have who are in the city of Berkeley or have clients that live there, Berkeley Mental Health has its own system of care, pretty much, and they have a mobile crisis team, and they have a clinic that treats individuals that are living in Berkeley or Albany. So if you know, if you don't remember this and you call our teams and the person lives in Berkeley, we will just direct you to Berkeley Mental Health. Any questions about that? Okay. Language specialty. So these are the numbers if pretty much access numbers for individuals who speak Spanish. The Asian languages, which there are many, I think there are about 8 of the threshold languages that are covered. Excuse me. There's a TDY line, and also for those who are hearing impaired. And you may share these numbers as well. All right. That is crisis services. Any further questions?
Definitely feel free to unmute yourselves.
I'm wondering if you'll be sending out, if you would be willing to send out these slides we can reference back. This has been really helpful. Thank you.
Yep, we are.
Yes. Yep. We can send those out. I also have a, let me see if I can do this. I have another that gives a little blurb. Did I stop sharing? Yeah, I did.
Yes.
I'm going to do it. Yeah. There we go. There we go. Can people see that? Let me make it bigger. This COVID time is really stretching us, isn't it? I'm learning how to do all kinds of stuff. Can everyone see this? Okay. So this is a one-pager that you guys can send out as well that, sorry, gives a little bit more information in a quick one-page, summary of all of our services and the main number for contacting us. So we have a mobile crisis team with the acronyms, mobile evaluation team, community assessment and transport team, outreach and engagement, post-crisis follow-up, crisis connect, community connections, familiar faces. There is my email and the clinical supervisor, Yesenia Lott. You can email me directly and we will answer whatever questions you may have. If you utilize any of our teams and want to give great feedback, that's wonderful. And also if things don't go so well and you want us to really review, our interaction with someone that you referred, or even, sometimes miscommunication happens, or you don't have enough information, or, something doesn't go well, you can also reach out to our teams. We are constantly trying to improve what we are offering and really meet the needs of the community. So that will be shared as well. Yep. Any other questions? Comments?
We do have one question on the chat. Last year, someone called the crisis line for young men in their community. They came out, but the men refused the services. Are there additional resources in this case when someone really needs help but doesn't want it?
Yes, that's a good question. We have a lot of individuals who, just aren't willing to engage. And so what we continue to do, especially with community connections and familiar faces, our outreach and engagement efforts aren't time limited. So we also don't want to harass people either. So even if we come out once and the person is refusing services, we try to continue making contact. And sometimes we lose contact with individuals. They either move or they're homeless and they're transient. And so what I encourage individuals to do is to continue to refer that person. We're currently working with a particular business district who has a resident homeless person who, is up and down in terms of his appropriateness or not being appropriate in the community. And so we've been reaching out to this person, and we'll get emails or phone calls saying, oh, he moved to this location. Can you guys try again? We try to offer incentives. We have gift cards we give out so we can buy a person a sandwich or some coffee. We have things like toiletry kits and socks and t-shirts. And we also are giving out masks. If we have contact with someone, we have N95s that we are sharing also, and hand sanitizer. And so, we know in this work, sometimes it just takes a while. So we will continue to outreach. There's also in our adult system of care, our IHOT teams, and the way in which you refer someone to those teams is through access. So if you don't think it's a crisis situation, but it's a chronic situation and you don't know what to do, if you happen to call access and say, hey, we got this guy out here, I don't know, he needs something, or, my client keeps coming in, they're not really engaging in services, you give that information to access. That clinician will also determine if there's another outreach and engagement team in the county to refer them to, or if it needs to come to crisis. So you don't have to know exactly what the person needs, just the right numbers to call.
A clarifying question for you. For the texting line, is it only for teens or can adults use it too?
Oh, anyone can. Anyone. I just Crisis Support Services, when they started it, they specifically started for youth, but they're finding that, many people use it, so anyone can. You can also reach out to Crisis Support Services to request business cards with that information, so you can have a bunch of them on hand to hand out to folks you're having contact with as well. Yeah. Anyone else?
Yes, we do have a question. Once folks outreach to your team, do they have to disclose the client's mental health history or issue? Do you think it's a breach of HIPAA or confidentiality?
So if you are referring an individual for mental health services, continuity of care allows you to share that information. We can't, on the back end, we can't really call you back to give you a lot of information. What we often share with providers is that we made contact and we will continue our efforts, or we'll try and engage this person. And so you sharing information with us is allowed, because you would need to for the referral, because we want to know why we're going out, what's the history, what's the risk or urgency. Even when you're calling 911, if you are at the point of calling 911, it's a crisis situation, so you can share relevant information. Do you need to go back to, this kid was 5 and he was in CPS and he started a fire and this is what, no, unless it's relevant. But you can share information in a crisis situation. And with our services, you can, for referral purposes, you can share a lot of history. Anyone else?
Actually, someone had an idea, especially for neighborhoods or in communities that has many people who are experiencing homelessness, like West Oakland, perhaps even putting some information on billboards or mail this kind of information to families. This person wished that, wish she could help more people about this service that you're sharing with us today. Mm-hmm. Another person asked, are you able to share more information about IHOT? IHOT?
You know what? Yeah, I can, maybe I should send you guys information about IHOT. I know a little bit and I don't want to share incorrect information. So I will make a note to get you some information on IHOT.
Great. So in addition to the PowerPoint and this handout that you're seeing, Stephanie will send us also information on IHOT.
Yeah. And for the person who had to comment about some ideas about advertising and things like that, great ideas. The county is definitely looking at getting this information out. I participate in a lot of, well, before COVID, it was face-to-face meetings in the community, but even now on Zoom, community meetings that have consumers and also family members and providers sharing this information. There are also other programs like the Trust Clinic is out in the community providing street medicine and also getting this information out around crisis services. So we are really making those efforts to get the word out to the community. So thank you. Anyone else?
Definitely feel free to unmute. We do want to hear your voices.
Yeah.
If there are no further questions, I guess we can end a little early. You'll have about 7 minutes of your time left in your day. Thank you so much again, Stephanie Lewis, for all of this information. It's a lot of information, but don't forget that we're going to be sending out the PowerPoint, a couple of handouts as well. So feel free to email us for any other things. We'll be having more and more trainings throughout this month as well as the remainder of the year. So keep take a look at our calendar at the portal that you've received this information from. But again, Stephanie, thank you so much for all this.
Thank you. You did a great job monitoring the chat too, David. Thank you.
May I ask one more question? Thank you. This has been so helpful. And I'm wondering if the recording will be available, if we could share with like interns and folks who just couldn't make it.
Yes, that will be available at a later date. But yes, we all of our trainings will be recorded from, I think, COVID and on. We'll have recordings of all of our trainings. That will be shared later, but definitely we can send out the attachments beforehand.
Thank you.
Thanks again, folks. Have a wonderful, wonderful day. And thank you again, Stephanie, for everything.
Thank you. Bye-bye, everyone.